Hi, Dr. Garima here. Hope everybody's doing well, and we are shooting another video for the ADC exam. Very good question, one of the most irritating questions I would say for the candidates, because as much as we love dentistry, somehow the infection control booklet makes it annoying and irritating for a lot of reasons, because you have to just memorize everything. It's not like a logical explanation to it, but that is an important part of dentistry, because this is after all a healthcare, and as much as the patient's health is important, your health and your staff's health is also important. Okay, so you need to know what kind of precautions come with what kind of diseases, and how do you manage infectious diseases, because at any point of time you have the power to treat and heal, and a patient might come with an acute spreadable infection. So you have to do your duty of giving him the proper care, but at the same time you have to protect yourself, manage the consequences if you get exposed, and manage the staff as well, correct? So that's why we are also warriors because even our health is at risk, right? So definitely around 5 to 10 questions from infection control would be asked in your exam. We have the infection control booklet. These kind of questions pretty much have one straight answer. They will never be unmarked questions. So knowing these questions, the concepts is actually a very big advantage, because these are scoring questions. Okay, so nothing much of logic or brain is needed, just pretty much straightforward answers, but you should know them, right? So let's start solving. Adrian Cruz is a 35-year-old male who attends your practice today. Adrian is seeking dental care for a severe toothache in upper left jaw that has been present for 2 days. Severe toothache. He's in pain. You have to do something about it. Adrian was exposed to hepatitis B virus 10 months ago, which subsequently led to acute hepatitis B infection. Okay. He was never vaccinated against hepatitis B due to his parents' strong anti-vaccination beliefs. Yeah, many parents do not like children to be vaccinated. It is what it is. Upon clinical examination, you diagnose tooth 2/6 with irreversible pulpitis. The tooth is not restorable due to extensive caries. You also notice other teeth with carious lesions that need urgent dental care. Your treatment plan today is to extract his tooth 2/6. Okay, so here's a patient. He's in severe pain. He wants you to extract the 2/6, and you also have decided to extract the tooth 2/6. But he was exposed to hepatitis B virus, which is known, and he ended up with acute hepatitis B infection. Now, this question doesn't mention that he's having acute infection right now, but he did end up with that. Now see, one thing in the body, whenever there is an acute stage of infection, the antigen of that disease would be activated. When it's a chronic stage of infection, or even if the infection has resolved, then the antibody will be detected. So when the surface antigen is detected of that particular virus, antigen is basically that virus, is detected in your body, it means an acute stage of infection is going on. If an antibody is detected for that virus, that means the infection had happened and the body has produced antibodies, and it's either fighting off that infection, or it's gone into a chronic stage, or there is no more infection but the antibody is there, giving you an indication that such kind of infection had happened. Okay, so an acute stage of any viral infection would always be detected by the presence of the antigen. Okay, so you discuss with Adrian his general health, and he shows you his blood test results from 1 month ago. It's just been a month. What positive lab test indicates that he is presently infectious with hepatitis B virus? The answer is A, hepatitis B surface antigen. Okay. If you want, you can pause this video, go to either open your microbiology, yes, second year, or you can just Google. You need to understand certain antigens are present in the body for a certain duration of time. Certain antibodies can be detected only after 3 months and some only after 6 months. Certain antibodies like IgG, etc., they will be there in the body for that particular virus for say 6 months only. After that, the long standing antibodies can be detected. So each of them has a time span. Based on that, the detection of those facilitates you to understand this was a recent infection, a chronic infection. Was the patient ever infected by this, even though he may not be having that infection right now, So it's very interesting. I know we just studied that subject for a bit. It was in the second year and then pretty much let it go. But it's a very interesting subject if you go through it, So anyways, it's just for your knowledge purpose. You can go ahead, brush up through that. Someday I think I should take a video on antigens and antibody. It would be fascinating, But someday, not today. So for today, what you need to know is whenever there is an acute stage of infection, the first thing that would give it away is the presence of an antigen, okay? Your dental assistant expresses concern about the higher infectivity of hepatitis B compared to HIV and asks for your advice on the necessary infection control precautions the team should take when extracting Adrian's tooth 26, okay? What is the key precaution that should be taken to minimize the risk of hepatitis B virus transmission from Adrian to the team and other patients? Okay. Usually, you follow proper precautions and schedule the patient at the end of the day as the last patient, so that you can then just go ahead and fumigate the room and leave the clinic, thereby ensuring that no other person comes in contact with such a patient, and you have followed your PPE measures and extra precautions, and then you fully disinfect the entire clinic once the patient leaves. So usually we schedule the such patients at the end of the day. So that is your answer. After extracting Adrian's tooth 26, you notice that one of your fingers was injured. Ouch. And bleeding when you removed the used forceps from the bracket table. Okay, you arrange for an immediate blood test which shows that your level of protective antibodies against hepatitis B is 98 milliliter unit per ml. It's decent. The level is decent. What is the appropriate post-exposure protocol you should follow in this situation? I want you to go and read that. What is the minimum level of hepatitis B antibody that should be present in your body? I'm not going to give this answer. I want you to read, because this will be another question, and this question has been asked in the exam. So I want you to open your infection control booklet, and I want you to read what is the minimum level of the antibody that should be present in you if you have taken the vaccine, and at what level you should top it up if it's less. So first thing is that. Second is, how many of you all had needle prick injuries? just write in the comments. I just want to know. I had multiple times. I treat children exclusively, rarely adults. But yeah, especially during giving inferior alveolar nerve blocks, if the child just moves and I'm retracting with my thumb, I end up picking my own before I inject. And then I'm like, shit. So, yeah, I think in my past 12 years of careers after passing MDS, I think once every year I must have injured. Like, I'm pretty careful, but no matter what, you do end up. So, luckily in children, I'm not at that risk to be exposed with infectious diseases as much as you can be with adults. But yes, I'm sure you all must have also had your stories. Leave in the comments. Let me read what are your stories, how you dealt with it. Yeah. So, yeah, what do you do when you find that your finger was injured? What is the appropriate post-exposure protocol you should follow in this situation? Okay. Have a single dose of hepatitis B immunoglobulin within 48 to 72 hours. Basically, take a booster shot. start a course of vaccination within 7 days, have an assessment by an infectious disease physician, prescribe an antiviral medication to protect against hepatitis B. No follow-up is needed as your protective antibody levels are sufficient. Okay. Now that option E kind of gave up the answer, you know. See, 98 ml is decent. I wouldn't say appropriate, but it's decent. It's not less. But like I said, I want you to go and read about it. Because it's not less and it's appropriate, I would have to say, you should have an assessment by infectious disease physician. If this option would not have been given, then probably you could have chosen option A. Okay, option D is not the correct answer. You should not take an antiviral medication by yourself. You still need to visit the GP. There is no harm in going for another dose of hepatitis B vaccine. But if I have the option of having an assessment by an infectious disease physician, I would opt for that first. And then let him decide what needs to be done, you know. Maybe if he says, you know, you have just enough antibody, just let it be, then you let it be. If he says, no, go for a booster dose, then you do. So I would choose option C. If that option is not given, then I go ahead with option A. Now you acknowledge the emotional discomfort you feel about the potential exposure to infectious diseases while treating Adrian, but you also recognize his oral health needs and your professional obligations. Here I always remember Spider-Man, Tobey Maguire's second movie, where he has the power of spider, of course, like the whatever superhero power, and he wants to live a normal life, you know, and he actually starts living it. And then one day he's just standing against the window thinking, what do I do? Should I just live a normal life? Because I have the power, I can actually help prevent many things. Am I obliged to do that? And then he decides, with great power comes great responsibility, right? The famous dialogue. So yeah, you have the skills, you're practicing, you cannot just run away because a patient is having infection. So the answer is you take a refresher training on managing sharps so that you become confident if such an incident happens, but you cannot refuse to treat, you cannot run away from your obligations. Understood? With great power comes great responsibility. And that is one of the reasons I am also shooting this video, because when I started shooting videos and you know, just spreading knowledge, like I am also a lifelong learner, and so many people commented and said so many great things, like it helped them so much. It made me realize that my clear way of explaining and giving the concepts and just directing in the right way has helped so many people. So I should just continue to do so, because it helps people. Like, I literally gain nothing out of it, but I am responsible because I belong to this field, you know, and one of the responsibilities or obligations, I would say, is to spread the right knowledge. Because if many teachers wouldn't have thought about doing so, even I would not have been in the position where I am. So you have to give back, you know, what you took. So life goes round and round. So anyways, I'm happy doing so. It also gives me happiness. It's a lie if I say I don't get anything out of it. I do get happiness when I read your comments. So looking forward to your comments. So I do derive happiness. Let's put at that. And the last, before my son actually breaks down the door because he's knocking constantly. As a result of this incident, you have reviewed the immunization status of your practice staff for vaccine preventable diseases. In addition to hepatitis B, with what other standard vaccination should dental staff ensure they're up to date? It's a viral influenza. You need to make up that. So with that, I end up this video because he's banging on the door. And have a nice day. And like I said, go through those 2 books which I have mentioned. Which are those 2 books? It's the sample. I'm happy to share the sample copy of comprehensive ADC book and the ultimate ADC companion book. These are the 2 books which I would recommend if you're going for the ADC exam, as these are practically the question bank for the exam. and I will write my email in the link, and you can email me, and I'm happy to share the sample copies of these two books. Have a nice day. Bye bye.